Hi, I am Dr. Nischal, practicing as a consultant dermatologist at Nirmal Skin and Hair Clinic, Vijayanagar in Bangalore. We have Fraxis Duo for past 6 years in our clinic and I am really happy with the instrument. One, because it has multiple technologies. I can do microneedle RF, I can do fractional ablative CO2 as well as an ablative CO2 laser. So I have these three instruments put in one single instrument. So that's an added advantage, so that has reduced the cost for me on the technology. Microneedle RF is a very nice technology where it gives wonderful results for acne scars. This is the commonest indication where we use microneedle RF. The downtime is less, the patient tolerance is good. No doubt it has some discomfort when we are doing the procedure, but that's manageable. The results what we achieve are much better than like whatever I'm achieving with the CO2 laser. So because of this, I'm preferring microneedle RF over CO2 laser, because CO2 has little bit of more downtime when compared to microneedle RF. Microneedle RF has also been used for treating laxity of the skin, stretch marks, in addition to scars. Sometimes we also do in cases of mild acne, which also ablates the sebaceous glands, overactive sebaceous glands. The inflammatory nodules come down with microneedle RF. So for these indications, we are using microneedle RF. We do multiple sessions. Usually patients require about 4 to 5 sittings and we gradually taper them off. Carbon dioxide laser in a fractional ablative mode, I have been using it for acne scars, I have used for striae, sometimes as a laser toning I have used. When people have a lot of acanthosis nigricans, I have used it as a laser toning. It helps in improving the skin very nicely. Hypopigmentation with CO2 laser is not so frequent. As far as I remember, in 6 years I have seen one case of hypopigmentation and we were actually able to manage it very nicely. We did Q-switch Nd:YAG laser for that patient with hypopigmentation and finally I removed it with CO2. So a CO2 hypopigmentation goes away with CO2 laser itself. In addition to this, the ablative laser, we have been using it to treat various other conditions like skin tags, warts, and many times even molluscum I have removed with CO2 laser, ablative CO2 laser. Not only this, I have treated neoplasms with CO2 laser. We have efficiently treated a extensive large Bowen's disease which was there on a 93 years old lady on the cheek extending onto the submandibular area, and it healed very nicely. The scarring was minimal and she is very happy, and it has been nearly close to 5 years now. There is no recurrence of the lesion. We have also treated one more Bowen's disease on the forehead as well as a basal cell carcinoma with no recurrence. So the indications for CO2 laser are like vast, and we have been using it very safely with minimal side effects. So I think for an investment thing for any dermatologist, this is a good technology where you have all three things put in a single machine.